Hello, good day everyone. My name is Musa Mohammed Mancha, 2D, Gulias College of Medicine, University of the Visayas. Today I will be making a video describing the procedures of carrying out phlebotomy, that is the venipuncture, and in a layman language, the act of taking a blood sample from our body to be used to carry out some testing in the lab. Now, here before me are some of the materials that is required for this process. As you can see, here is our needle and syringe. Also, here we have our test tube. And we also have the cotton balls. Then we have the tissue for cleaning some dirt. We have our disposable surgical gloves. Also, more of the gloves are here in case this is not enough. Now we have the 70% alcohol for sterilization and cleaning the surface of our patient's body where we are to take the blood sample. And also this is our tourniquet. This tourniquet is what we are going to use to tie the upper part of that's the superior part of the cubital fossa, or in other words, the antecubital fossa. And the function of this is to make the vein to be very prominent so that it will be easier for us to identify the vein, because this will cause venous filling, thereby making enough blood available at the surface we are to take the process. Now, before we continue, here is our patient for today, and it's important you allow your patient to introduce him or herself. So please, ma'am, good afternoon. Please, may I know you? What is your name?
Good morning, Doc. Good afternoon, Doc. I am Julie, the lead.
Thank you, ma'am Julie. Nice to meet you.
Nice to meet you, Doc.
Please, what is your date of birth, Miss Julie?
My date of birth is June 12, 1994.
Thank you very much for that. And if you don't mind, please, how old are you, Miss Julie?
27, Doc.
Okay, thank you very much. Having known our patient's details, it's also important that we seek the consent of our patient so that she will feel more comfortable and relaxed during the process. Please, ma'am, we are about to carry out a venipuncture, okay? We call it phlebotomy, the act of taking a blood sample from your body so that we can be able to carry out some tests for you. Please, is that okay by you?
It's okay, Doc.
Thank you very much. Having introduced the procedure or the process we are about to carry out to our patient, now we are going to continue. It's very important that first of all we sterilize or clean the surfaces that we are going to use in carrying out this process. Like I said, this is our 70% alcohol. Okay, I'll be using this, and of course initially I will clean this particular surface where my patient is going to place her hand to avoid some microorganisms and bacteria on the surface. Okay, and whatsoever material you use during this process, you dispose immediately for safety purposes on the trash can. So here over here is our trash can. Okay, now this process to carry out phlebotomy, there are about 3 common veins that are very good for this process. Okay, these veins include the basilic vein, the cephalic vein, and the median cubital vein. Okay, among these three veins, the basilic vein is the least preferred, while the median cubital vein is the most preferred. So in that case, we will be using or taking our blood sample from the median cubital vein. Now, before I make any contact with the body of my patient, it's always important I wear my gloves, as I've done already, and also I sterilize my hands with alcohol at every step of this process. Okay, so Miss Julie, now we are about to take the blood. Okay, now you look at the antecubital fossa very well. Usually the basilic vein is located at the lateral side of the forearm. Okay, yes, just beside the cubital fossa. Okay, and over there is also the median basilic vein. The cephalic vein is a branch of our basilic vein. So, but we will be using the median cubital vein. Okay, so over here is our median cubital vein. Now, before we proceed, okay, we need to use our tourniquet. Like I said earlier, the function of the tourniquet is to make the vein to be very prominent and easier to see, and at the same time causing the venous filling, so that blood will be very available in that area. Now we are going to tie our tourniquet on the superior part, okay, the superior area to our antecubital fossa, and usually the tourniquet should be tied at about 2 to 4 inches above the position of our vein at the antecubital fossa. Okay, so when I finish tying this, okay, yes, so the next thing, having tied the tourniquet, I am going to sterilize the surface where I am about to carry out the venipuncture. And usually the sterilization should be in a circular manner, okay, like this, the way I'm doing it. Yes, this is the proper way of sterilizing. And immediately I finish this, then I'm going to throw this away. Yes, as we can see, the vein is becoming more conspicuous for us to carry out the process. And after sterilization with alcohol, you allow it to dry for about 20 to 30 seconds. Okay, now, since this is already dry, the next step of our process is to take the blood sample. Here before me is the 5 ml needle and syringe. Okay, usually we can actually use two things to take the blood, either the 5 ml needle or the butterfly needle. But for today's video, we will be using the 5 ml needle. Okay, you can see the needle with the cap, okay, yes, on the needle. So now the next process is for us to identify the median cubital vein and place our needle. Usually the needle should be placed at about an angle of inclination of 15 to 30 degrees. Okay, an angle of inclination of 15 to 30 degrees for the efficiency of this process. Okay, so now I am going to insert the needle inside the median cubital vein. And in the process of doing this, I have to hold the skin very well. Now, having inserted the needle and the blood is already flowing into the needle, before I draw the blood to have the specific amount, specific quantity of blood that I need, I am going to ask my patient. Initially, of course, I will tell my patient to make a fist of hand, okay, this way, okay. So now, having inserted the needle, I will tell the patient to release the fist and free her hand and the forearm in the supine position. And the next thing, I'm going to remove the tourniquet from the patient, okay. Now, having removed the tourniquet, then I will now draw the amount or the quantity of blood that is required. Yes, now I have the particular amount. So before I remove the needle, okay, to avoid hematoma, I need to place the cotton balls immediately on the surface, okay. Then I am going to remove this gradually, okay. Okay, now we have our blood sample. Then I will tell my patient to flex her hand full flexion to avoid hematoma. Now, with this my blood sample, the next thing I will do is to insert or to put all this blood sample inside the test tube. Remember, this is our test tube, so I'm going to insert all the blood inside. And the essence of this is to avoid hemolysis, the lysis of the blood. That is the reason why we need to put this blood inside the test tube. Okay, now I have inserted all the blood. So I'm going to dispose the needle properly. Okay, we are done with the needle. Now we have our blood sample inside the test tube. Now, it's important that we label the test tube very well for proper identification. And the things that should be on the test tube include the full name of my patient, the date of birth of my patient, then the date and time of when this procedure was actually carried out. And lastly, as the doctor, my initials, the initials of my name will also be included on the test tube. Then this will now be taken to the lab for further examination and testing. Now, we've actually come to the end of the phlebotomy, but importantly, okay, some of our patients are scared or somehow not comfortable. So after the process, you need to ask your patient about comfortability of him or her. Now, Miss Julie, are you okay after taking the blood, or do you feel any pain?
I'm good though.
Okay, thank you very much. Now, before I ask my patient to relax the hands, remember I asked the patient to flex and I want to remove. So I will now use the bandage and the plaster to ensure that the blood actually does not flow from the particular site, okay? Yes, I will remove the cotton ball, then I'll put plaster and I'll ask my patient to hold this for some particular time. So once again, my name is Musa Mohammed Mancha from section D. So briefly, this is the procedure of carrying out phlebotomy, that is our venipuncture. Thank you for listening.